trauma, maxillofacial trauma. And then the other one we were just talking about, which I think is maybe even more common, is a case of like bad angioedema or swelling of the face. So say someone starts an ACE inhibitor, right? It was like the test question. And all of a sudden their tongue is like herniating out of their mouth. Yeah, where are you gonna put that ET tube? Nowhere, right? So I was talking to the other group. One option that we have, which is cool, is we can do a nasotracheal intubation. I can load an ET tube onto a bronchoscope, pass it through the nose, through the cords, and then do it that way. But again, here, we're talking surgical airway. So my number one thing is a lot of textbooks will talk about maybe a horizontal or a collar type incision. I'm a big proponent of doing a vertical incision, okay? There's a little bit more vasculature laterally here, aside from the big obvious vessels like your IJ and your carotid out here. But there's even these little bridging veins that you can avoid if you just stay in the midline and stay vertical. The other advantage of a vertical incision is I can go up or down with it. I'm not committed to wherever I make that first incision like I am with a collar or a horizontal incision, okay? And so then the other thing that I showed the last group, which is cool to me, is I actually use a minimally invasive percutaneous technique when I do my tracheostomy. It's called a blue rhino kit. And so literally I'll make a small incision and then I'll carry this down into the trachea there like that. And then I'm pulling back and I see air. I know I'm in the airway. And then I would take this off and use what's called a cell dinger technique. And I'd put a wire in here. And then I'd take this out and I'd dilate and I'd throw the tracheostomy tube in that way. Okay. So again, it's just other things to think about and be cognizant of. But again, the big thing in my mind is making that vertical incision. So feeling the anatomy, finding that cricothyroid membrane, and making a vertical incision over it. And the thing too, this is not a cosmetic procedure. So if you're really in the situation, like, don't be bashful, because you can save someone's life if you get this thing in. Right. And then how do we know it's in once we place it? Just like a ET tube.
Yeah, you're checking for air.
So again, that's what's the answer on the test?
Check for chest rise and fall when you.
There's one thing. Nope.
Capnography?
Exactly. Right. Always waveform capnography, end tidal CO2. That is the answer. Not chest rise, not chest x-ray, not breath sounds, you're gonna do all those things. But the answer is end tidal CO2, waveform capnography. So give it a go. You can wear gloves if you want. And like I said, you're really gonna feel for that cricothyroid membrane. Make a nice